just as the whole transport landscape has changed.
It's really evolved in that sense, isn't it?
Everybody has now got different expectations. So it's...
Welcome to today's meeting of the Health Committee. Members of the public may wish to follow at London Assembly on Twitter and use the hashtag AssemblyHealth for this meeting. Please may I remind participants to silence your devices, and the main item on the agenda today is our discussion on healthy living, everyday physical activity. However, we have a few short items of business first for the committee. So can I now ask our clerk, Diane, to confirm any apologies for today's meeting?
Thank you, Chair. We have no apologies for today's meeting.
Thank you. Can we note the list of offices held by Assembly members, and can I ask members if they have any disclosable pecuniary interest or any specific items listed on today's agenda? No. Noted. And can we confirm the minutes of the meeting held on the 30th of June 2022?
Confirmed.
And can we note the completed and outstanding actions arising from previous meetings?
Noted.
Can we note the response from the Department of Health and Social Care to our investigation on the indirect impacts of the COVID-19 pandemic? And that brings to us today's main item, and I'd like to extend a warm welcome to all of our guests joining us to discuss healthy living, everyday physical activity in London. We have Dr. Katie Hunter, who is a consultant in public health at the GLA, Dr. Will Norman, who is London's Walking and Cycling Commissioner, Vicky Hobart, who is the Group Director of Public Health and the Deputy Statutory Health Advisor for the GLA, Tanya Braun, who is the Head of Policy and Communications for Living Street, Alison Gordon, who is the Head of Prevention Services at Age UK Enfield, Sarah Dewhurst, who is the lead allied health professional for the Physical Activity and Clinical Champions Programme at the Office of Health Improvement and Disparities. That is quite a mouthful, but yeah. You're welcome. And Alan Benson, who is the co-chair of the Board of Trustees at Transport for All. So welcome everyone to the committee. I should mention that we will have a short adjournment break at 11:30, just so that people can have a rest. Sitting for too long isn't great from a health perspective as well. And just be mindful that we may have a school visit today as well. So if you see children in the background, they are here as part of engaging in our democracy in London. So I'm going to start off with the first question. I'm going to ask the question to Vicky first, and Sarah, if you can come in afterwards. And when you answer your question, there's a person with some sound waves to switch your microphone on, so please speak into the microphone because this meeting is recorded, so that people also, while it's being live streamed, can view and listen to what you're saying as well. So the first question is, what role can everyday physical activity play in improving the health of Londoners and reducing health inequalities?
Thank you, Chair. I'm delighted to be here today for such an important discussion. So if physical activity were a drug, we would refer to it as a miracle cure. So I'm sure a number of us have heard that cited before. And really that's a reflection of how important physical activity is across the life course, both in terms of preventing disease, helping people manage both long-term conditions and their recovery from illness, and a wider set of kind of benefits. And I'll just talk through those briefly. We're also the first generation that's had to make a proactive choice to be physically active. So that's come from the most recent government guidelines around physical activity. So it has largely been designed out of our lives on a routine basis, and we're one of the first generations to be experiencing that. So how we design it back in is really important. So three broad elements of physical activity and health that are important: for strength, both muscle mass and bone density; stamina, so our cardiovascular fitness; but also balance as we particularly as we age. And we have the CMO guidelines, which are relevant to different parts of the life course on that. It's important across our life course, so for children to build up bone density and muscle mass, in working age and middle age to maintain that, and then as we age with the potential natural loss, to prevent muscle decline and bone loss around functioning and independence as we age. We also need to combat the sense that physical activity is not for people like me, in the general sense, people with protected characteristics, disabilities, but also the impacts of the social determinants of health. So how income or social circumstances, housing, etc., affects people's ability to maintain active lives. So the government strategy is around everyone active every day, and that it does apply to everybody. It reduces disease risk. It helps with management and control of long-term conditions. As I say, it helps with recovery from illnesses. It helps people maintain a healthy weight. It improves mental health functioning and can help from recovery of things like depression and anxiety, and it maintains function and independence. So why active travel rather than active living or active recreation or active sport? Well, partly because we are actively travelling to do those things, but also because active travel is accessible, achievable for many people, it's equitable, there aren't the cost barriers, etc., and there are a range of co-benefits, like improvements in air quality, reductions in congestion, and improved social cohesion that also have health benefits. We have quite a good understanding of the barriers to physical activity, both for the general population, people of different ages, but also for people that are experiencing long-term conditions. And my colleague Sarah may well pick up on this, but some of the barriers that people with long conditions experience in becoming more physically active in their daily lives. And active travel is important because we can design in solutions to this. So in the same way as physical activity may have been designed out, we can design it in going forward. There are also wider benefits that we need to consider: demand on the health and care system, and potentially demand for things like welfare provision and economic productivity. Finally, just thinking about the pandemic and the impact that that's had and why active travel has come to the fore again. In some ways, the pandemic provided an opportunity for people to reconnect with their local communities and their local areas, and there were positive benefits of that. But we also need to recognise that a number of people with long-term conditions may have been much more hesitant to do that, may have been shielding, and may have had concerns about that. So it's a complex picture. But the basic premise of the government strategy, everyone active every day, still stands: enormous health benefits. And that active travel, whether you're travelling for work, you're travelling for shopping, to access services, to access leisure, to access your caring responsibilities, is a really key way of achieving that. Thank you.
And Sarah, can we hear from you? Because I think Vicky mentioned the barriers as well. So could you just draw on some of those as well?
Certainly. Thank you, Chair, and thank you for the opportunity to speak with you today. So I'm Sarah Dewhurst, and I have a clinical background as a physiotherapist where I work in oncology rehab. But my sort of reason I'm representing today is the Physical Activity Clinical Champions Programme, which is part of a wider umbrella programme called Moving Healthcare Professionals. And we've already talked about Everybody Active Every Day, which was a government policy back in 2014. And it was the first piece of policy really to build on that whole systems approach and recognising the need for systems to work together to reduce the barriers to physical activity and to promote physical activity across the board. And one of those sectors which is really important was about healthcare education, and that's what the Physical Activity Clinical Champions Programme aims to support. So Moving Healthcare Professionals Programme is an umbrella term for several pieces of work which is looking to upskill our healthcare workforce. And they do that through a number of means, through e-learning modules, through online web resources, through looking at the undergraduate curriculum and recognising that with our healthcare workforce in existence today, the level of education they would have received on the importance of physical activity as a preventative healthcare means was very limited. And it remains limited today, and it's one of the pieces of work which is being addressed. But in recognition of that, we've got a workforce out there who sees people with significant complex healthcare needs every day across London and across indeed the UK. And the opportunity using a make every contact count approach in terms of supporting behaviour change really exists for those conversations to have to be able to support and address some of the barriers around physical activity which you've asked me to touch on. So in my clinical role, we see people with cancer every day where I work, but these patients who are presenting in front of us don't just have cancer, they have complex multi-morbidities, and the barriers they face to being physically active are many and are real. For some of these people, if they'd had the opportunity to be more physically active earlier on in their life, perhaps it might have changed their reason for attending in the first place at the hospital I work at. But that combination of their disease and other comorbidities presents barriers in terms of access to be able to partake in physical activity. And it also has limits their ability to perhaps work, to provide the finances to take part in more organised sport. We've got colleagues here who have far more experience than I do in some of the barriers related to travel and getting to physical activity opportunities, or indeed to use active travel as the means to achieve the physical activity targets. So this is a real issue for Londoners, for the people that we see in our clinics in terms of supporting them to be active for a number of reasons.
Thank you, and that flows very nicely onto the next point where you ended really from, and it'd be great to hear from some of our voluntary sector guests on the issue of barriers as well. So my next question is, what are the main barriers that prevent Londoners from being physically active as part of their daily lifestyles, and which groups do you feel are disproportionately impacted by these barriers? I'll start with Alan.
So thank you, Chair. Thank you for the opportunity to talk to you. For the record, I represent Transport for All, which is the only national disabled persons organisation focusing entirely or exclusively on transport for disabled and older people. It's also worth noting that we're pan-impairment, so we cover all disabled people. We also are focused on the social model of disability, which basically says that the barriers that people face are in society rather than in themselves. So that's the context in which I'm talking to you. I think it's worth noting, to start with, that disabled people are disproportionately less likely to take part in active travel. They're half as likely to be active as non-disabled people. 1 in 4 people with learning difficulties are active monthly, compared to over 50% of non-disabled people. But I think there's good news in that 60% of disabled people report wanting to be more active than they currently are. So there's definitely a desire to do more. So if we look really at why disabled people are so badly served in active travel, there are some obvious barriers that I'll talk about a bit later in terms of suitable facilities and actual infrastructure. There is a cost issue, so often the equipment that disabled people need is more expensive, so things like adapted cycles tend to be much more expensive than standard two-wheeled cycles. But some of the barriers are internal. We've already heard that some of it is related to things like pain, things like breathlessness, physical restrictions that people face. But there's also an internalised restrictions. So people may feel unsafe either in the activity or in public places. They may feel embarrassed, they may feel that they're not represented, that active travel is not for them. And also there's a knowledge about what activities are available to them, so they just simply lack the knowledge. And I think there's also a big issue that travel is multimodal, and I think for many disabled people, that active part, it forms part of a greater journey. So it would be the walk to the bus stop, the walk to the station. And if those facilities aren't accessible, so we need to remember, for example, that only a quarter of rail stations are step-free, 76 of London's railway stations lack tactile paving, and bus cuts can mean that there aren't local services. So if people don't get the opportunity to connect to those transport networks, then they don't get that active travel.
Thank you for that. Move on to Alison from AGK Enfield.
Thank you, Chair, and thank you, Alan, for that. There's lots of information that Alan provided there, which I can elaborate on as well. I think it's very similar for older people, and even on my journey today, I noted probably 2 older people on my travels to get here today, because they tend to shy away from times when school children are out. They tend to shy away from large crowds on buses. So we often know when we're providing services to people that they want the timings of the session to be that they can get on the buses before the crowds build up. The volume and the noise can make them feel antagonistic and challenging towards younger people themselves, which causes this generational barriers. There's lots of factors. We think about economic disadvantage for people. Some of our streets are crowded. People don't feel safe. The postcode issues where there's youth violence in the borough that I represent is very noted. Older people don't want to come out to activities if they have to travel across some of the postcodes. Sometimes we get told that. So we're often thinking about providing activities directly within the areas of where people live. And that comes as a disadvantage to people that may have physical disabilities or other disabilities. Lots of church halls or community venues are not disabled and accessible and promote problems immediately. So locations and timings are really important for older people. When we think about we started off with saying about habits for people. Lots of older generations of people haven't got a healthy habit in the first place. They didn't take up sport until they got much older, or they had to work such long periods of time that they didn't make time for activities along this way. So it's not a natural habit, and it may be that they've then got a health condition, have been advised to take up something, then lack confidence, or again maybe feel ashamed to come out and do something. So there's lots of barriers, internal barriers as well. There's affordability. We try and make sure there's things that are available to people at low cost or no cost. But people often prioritise, and certainly with the cost of living crisis, moving things which benefit you is another thing. With the travel pass, again, that doesn't start until 9:30, so people won't want to do anything before that. So there's lots of internal restrictions, I think, which people have, and lots of environmental factors that come into it. Low motivation. The pandemic's had a massive effect on people. They lost confidence. We talked earlier about loss of muscle, balance, and strength. There was a huge deterioration in people during the pandemic, and people are starting to come back out, and people that were shielding were unable to come back out. So lots of opportunities were lost because of physical deterioration. I mean, there were other illnesses then developed if people were sedentary and inactive. So there's huge boundaries of lots of different things as well. We talked about cancer earlier on. If you've been affected by cancer or a long-term condition or diabetes, again, making a positive change, but then feeling fearful about being too unwell, or perhaps your instructor or the person in the class you're going to hasn't got the knowledge or doesn't understand what's going on with you is another barrier again. So there's lots of determinants which affect things. Thank you.
And Tanya?
Hi, I'm here representing Living Streets. Thank you for inviting me. We're the charity that promotes everyday walking, and in our long history we sort of started to stand up for pedestrians. So I think to pick up on something that Vicky mentioned earlier, We have sort of engineered walking out of our daily lives to some extent with the dominance of car traffic. So that's one key barrier, the amount of cars on our roads, from a noise perspective, from a pollution perspective, but also from a real or perceived perspective of safety. So that affects sort of all of our audiences, but then there's also personal safety, which may specifically affect older people or women or people from LGBTQ communities. So ensuring that lighting and wide pavements are available is really important. The street environment itself is really key as well. So things like not having cars parked on pavements, other elements of street clutter such as A-boards, they can be really off-putting for those who are either pushing buggies or are in wheelchairs, or who are just less able. But also the state of our pavements, are they crack-free? Are they smooth? Can we safely walk down them? Because that can really disproportionately affect those who do feel less confident walking, and can literally put people off leaving the house to walk journeys. I think connectivity is a key barrier potentially, and I think in relation to London specifically, we have very different barriers between sort of inner, central and outer London. And if you're living in outer London, it might be that you can't get from one part of outer London to another part of outer London that easily via public transport. So, you know, can you walk or cycle to public transport to get there? And if you can't, then that could definitely be a key barrier. I think, again, going back to sort of safety, particularly with children, we speak to lots of parents who are put off travelling actively with their children to school because of the state of the roads outside of schools. So if lots of parents are dropping their children off in the car, that can create sort of element of chaos outside school gates, and that unfortunately just makes the situation worse and creates sort of more feeling that you'd rather drop your child off in the car. And I'm sure we'll get on to what policies we think are really successful, but I think school streets are a really key way of avoiding that.
Great. Emma had a quick follow-up. Assembly Member Best.
Yeah, sorry, thanks, Tanya. Coming back to that point around the pavements, that's one of the biggest things that I hear back. It's the state of the pavements from especially older Londoners or disabled Londoners, and it puts them off. You know, sometimes, especially of older Londoners, they may have had the experience of one bad fall, and that then in turn means they won't again try to walk a journey. They'll instead use a cab or dial a ride or something like that instead of walking a journey they might have previously to the high street, say. In some of the policies that are being released, a lot of focus is on the road. You know, LTNs, for example, a lot of that focus is on road improvement. Has enough been done by the Mayor and the GLA to invest in pavements and pavement improvement over the last 5 years or so?
I think it is something we pick up on as a charity quite a lot, sort of, I'm talking broadly nationally, but a lot of the time focus is on the roads and is about filling potholes, and, you know, spending lots and lots of money on fixing roads, and I don't think pavements are often considered or thought about in the same way, and I think that they definitely should be.
Can I comment on that as well?
Yeah, go ahead, Alan.
Thank you. So the state of pavements is high on the list of reported issues that we get. Certainly uneven and rough pavements can cause serious levels of pain and discomfort that are long lasting. So if you go out, if you exercise, particularly wheelchair users, it can cause them then to need to remain at home for days afterwards to recover. There are obviously issues with pavements being accessible. with lack of drop curbs. Pavements that have a camber are particularly difficult for wheelchair users to push on. Camber is very difficult for non-standard three-wheeled cycles to navigate, and uneven pavements can quite easily, literally, throw you out of your chair. So it is a serious issue, and not one that is explored enough, I think.
Alan, sorry, I've got a quick follow-up. Do you have any views on pavement surfaces?
I'm not aware of any research that's been done, but my personal experience is that flagstones tend to get quite uneven quite quickly, so they're not great. Cobbles are definitely a no-no. Cobbles are a serious barrier, but surfaces that are level, even. Also, shared space is a huge issue, particularly for people with visual impairments or wheelchair users. And as was mentioned earlier, street clutter, whether that's A-boards or planting or those urban niceties that make places nice places to be, if they're not well organised, can provide or can represent real barriers.
Yeah, I think this has got the committee going. Andrew's got a quick follow-up, but quick, please, so that we can move on to the next question.
It does pique our interest, this issue, doesn't it? Because we've already experienced this. Is there an argument for increasing the sanctions against local authorities? Because currently local authorities only have to demonstrate that they have a programme of maintenance for pavements. And I think everybody assumes that they can make a packet of money out of the local authority if they trip up. Well, that's not the case. Is there something that could be done from government to improve, as I say, increase the responsibilities of local authorities? And to be honest, you always follow the money here. Is that to increasing their liability for things like inadequate services? Anyone can answer.
I think
Mr. Benson.
So I was going to say, I think there is almost an expectation that when you come across poor surfaces, poor environments, that you will complain. I mean, you mentioned the potential for legal action. I think one of the issues that disabled people regularly face is that there's so much that they face that complaining just becomes too taxing. There's just not enough time to register. So a lot of the time, people will just put up with or ignore or move on. They don't report the issues that they face. I think the other thing that's worth saying, in my experience, is that there's quite well documented standards for what a good pavement infrastructure should look like, but the implementation of that is not always consistent. So, for example, you'll get a drop curb on one side of a junction and not on the other side of a junction. So you can't do that point-to-point journey without having to perhaps go down the road. So the whole the whole point-to-point journey is the key bit.
I'm going to move on to Assembly Member Dr. Onkosahota.
Thank you, Chair. I want to talk about the impact of the pandemic on our physical activity and what the impact was right of that, and has this led to any long-term changes that are affecting our Londoners, the impact of the pandemic. Anyone? Okay, let's go with Sarah first.
Thank you for the question. I think this is really it's really topical. It's a really important question for Londoners, because I think the impact of the pandemic was significant on physical activity, and we know that from the figures which have come out from the Active Lives survey, which show that there was a significant dip in physical activity levels during the pandemic, and that although it's gradually starting to increase, we're not quite back to where we were. And I think that's also really highlighted the inequalities which exist beneath that data. So we know that certain groups are less likely to be physically active, and unfortunately that story is even more the case as a result of the pandemic. So groups from lower socioeconomic brackets, groups from certain ethnic backgrounds, and unfortunately for London, children and young people continue to be disadvantaged. So the factors, some of the gyms, facilities are now sort of open again, but there is something sort of bigger than that, which is which needs to be addressed in terms of being able to support people back to where they were. We've heard from Alison the longer term impact on older people in particular, that it's not just a question of sort of bouncing back now restrictions are lifted. Actually, these are people who have spent a long period of time at home not being active, and the knock-on effect in terms of their physical ability, but also their confidence to get out and about is lasting and sustaining. And we're seeing that in clinical practice as well. We're seeing people who come into us who are significantly more deconditioned, who are out of the habit, and who are not taking up sort of activity in the way that they might have done before. So it is a problem, and it is something which is lasting.
Right. And Alison?
Thank you, Sarah. Absolutely, we noticed this, and our colleagues across the whole of the educators in London, we were quite inventive during the pandemic, because all of our services were always in person for people. They were always based in community centres and church halls. With everything closing, people became very, very isolated very quickly. Their confidence deteriorated, their rates of falls increased, the admissions to A&E during the pandemic were lower. But immediately after the lockdown, when people started to come back out, there was a huge hike to admissions to A&E with people falling. We found that when we started to return to in-person services, we had queues of people turning up for our falls prevention services, which was incredible. I've never seen anything like it. They were socially distanced, of course, which made them seem even longer, but I've never seen people queue for it. And our KPIs for our delivery of falls prevention services are normally 600 people a year. We doubled that. We're at 1,400 people we saw between April 2021 and March 2022. And these were mostly people that self-referred themselves, saying they're at risk of falling and their confidence, and they've stayed on. We've got an 80% retention of people keeping up physical activity since then, which is incredible. I don't think I saw that before at all. But it affected people's mobility, confidence, strength, balance. It affected people who are affected by dementia, their cognitive deterioration. What we did during the pandemic was we provided a hybrid service, so we had online exercises which people immediately had digital inclusion from, so we had to do lots of work with digital champions to train people to be able to use devices. To obtain devices was an absolute nightmare. So we started to do door-to-door activities, and our colleagues in Barnet were fantastic at providing door-to-door exercise sessions where someone would actually physically go and do that. Our Fit for Life project manager, Mark Hobart, produced a follow-along guide with a resistance band, was issued to the whole of community, and we had about 1,000 of those distributed to people of Enfield, with a follow-on YouTube video as well. So we used lots of innovation to keep people active. And people really miss the connectivity, because when people are coming to our groups, our walks and our talks, they've met friends. There's one chap I can think of who comes along to one of our Friday groups. He says he doesn't see anybody at all unless he comes to the walk, and it's even worse in the winter. So that impact of those 3 lockdowns was massive, and we noted when we were doing our surveys and our monitoring of people that the last lockdown was the worst, and people just felt despair. So people are definitely coming back, and there's a steady demand. In our numbers of classes have increased, and our participants stay high. But I think it's because people can access things locally. With everything closing, the leisure centres, everything closing, it made a huge difference. Thank you.
Thank you. Yes, please. Yes, Tanya.
Sorry, just to add, absolutely agree with all of that, and at the outset need to say that obviously the pandemic was a really negative experience for pretty much everyone, but I think that something that did come out of it in a more positive way was a sort of community feeling and cohesion during the time, and the sort of understanding and appreciation for walking and cycling, and the sort of more active ways of travelling. And I do think that during that time people became more aware of those means of getting from A to B, because people didn't want to sort of mingle on public transport, and they were ways to get around more successfully and locally, because people did stay more local. And I think that is something that could be sort of capitalised on in a way, or learnt from.
Yes, Will.
I was going to come in on these points, and very much echoing Sarah's point around the inequalities and how the pandemic really amplified existing inequalities, particularly in levels of physical activity and with active travel. And I think it's worth just sort of unpicking a bit what Tanya was saying, as well as Alison and Alan's point, in the fact that we saw a growth in the number of people walking and the number of people cycling, which was fantastic. You could see it on the streets. You can see that number's been sustained. But that was not for everybody. Yeah, going to what Alan and Alison alluded to, for older people with people with disabilities, they didn't go out as much. We saw that in the change. But one of the reasons why physical activity, while we saw the growth in walking, we saw the growth in cycling, what we didn't see was the overall growth in physical activity. As we heard, that's dropped. Now, why is that? Yeah, is that actually active travel doesn't just come from walking and cycling. And we've got to look at this as a wider piece. It's absolutely core to look at actually this as part of the journeys. 50% of all walking journeys, all walking in London is associated with public transport. Yeah? People walking to the bus stop for stages, people walking to the tube. Now, the average car journey, you get about 1 to maybe 2 minutes of physical activity per car journey. If you're talking about public transport, it's between 8 and 12 minutes per journey. Yeah? Similarly, and then walking's about 17 minutes per journey on average, and cycling's about 22 minutes per journey. But if you take out that massive chunk of public transport, which is exactly what we saw in the pandemic, you're suddenly dropping this huge amount of physical activity that people have designed into their everyday lives because of that. And we've seen, although the numbers have increased, and coming back to some of the points colleagues made, we've seen some of the public transport return, but it's nowhere near back to pre-COVID levels for a range of different reasons. Part of that is change in practice of working from home. But I think with going back to what Alison and Alan alluded to, is there are still groups within the community who are fearful for going out, can't go out, their situations have deteriorated, and that's why we're seeing this sort of two different pictures, more walking and cycling, as Tanya alluded to, in those local journeys. But for a lot of people, and often for those people who probably need the benefits of physical activity most, they're the ones who are probably still facing the challenges in terms of how people get out and about.
Could I just ask for some clarification on data when you come to it?
Yeah, thanks. Yeah. I was saying that in this morning we've heard the word health inequalities mentioned a number of times, and in the last answer it's been mentioned twice. I was disappointed that the Secretary of State for Health, Dr. Kofi, didn't mention the word health inequalities even once in her speech in the House of Commons. Do you think it's that this time that the government did publish the health inequality strategy, which is now long overdue and very late in getting published, do you think it would be helpful if the government gives some direction on health inequalities? Well, let's start from Will then. Will, you're the Mirror advisor.
I think that would be very helpful.
Okay, great. Thank you. Okay. Well, let me go to another one. The government, right, has got a national trial going on walking, wheeling, and cycling as a social prescription. But the London has been left out of this. And I'm really disappointed about that. We have one of the most highest inequalities which is in London. And the mayor is having to work, right, with the NHS, right, on his own to try to address this issue. Well, can you comment on this? Can you provide me an update on what the mayor is doing to address, right, the the fact that London has been left out of this social prescribing initiative by the sector state?
Yes, I think this is true on a number of areas, that London is treated differently for a range of historic and policy reasons, and social prescribing falls into that. Active Travel England, for example, their remit doesn't cover London. Social prescribing is another example of that. But I think that's not to say it isn't happening in London, and we are seeing social prescribing as part of the approach. I know that I've been out with some of the groups that do social prescribing for walking, for example, where GPs are saying actually a bit more physical activity would be good for you. They've been working with the Canals and Rivers Trust. I know the Ramblers have been involved. I know a raft of other people. So there's a list of providers in London that are doing social are sort of a resource for GPs and other health professionals to sort of prescribe some physical activity. That's not just for sort of physical health benefits, but also for the mental health benefits. And I think that's often sort of really quite significantly overlooked. We've talked a bit about the physical benefits here, but actually, being physically active can reduce depression by something like up to 30%. It's actually an emergency intervention that is recommended for when in acute cases for mental health problems, actually being active because of the benefits that brings. So there is that social prescribing activity going on in London. There are trials going on with various different suppliers, and it's great to see so many of the voluntary sector being part of this. I think it's particularly important in terms of reaching some of those older groups. I think Alison wants to come in on that, but also some of the groups that maybe we heard earlier that this isn't for them. And I think that's overcoming some of those, having that sort of nudge, being prompted, having a trusted health professional provide that nudge to that within London is really good. And I'm really glad that this is something that the Mayor, the NHS, we're looking at TfL, and as well as colleagues across the voluntary sector are making sure that is on offer for London, because you're right, absolutely right, that there are huge health inequalities in London, which I think a bit more physical activity help overcome.
Did you want to come in, Alison?
I'd love to come in on that one. So I sit on social prescribing steering groups, obviously, and we deliver social prescribing services across all of London, but obviously predominantly for us in Enfield. And Sport England have a very active part of this, and so does London Sport. There are lots of initiatives out there, lots of initiatives coming from GPs directly. One of the initiatives that we were working with was called Talking, and it came about because 2 GPs in PCN in southwest Enfield decided that they were inactive, and they also noticed that they weren't doing anything. They were just working incredibly long hours, looking at Teams, seeing patients over the phone, and they decided to do something about it. And they thought, how do we get older people moving and more connected as well? So they put together the concept of Talking, very, very small funding to be able to do it. They had somebody who was more motivated, and then they had 2 other participants. So the 2 other participants were less likely to engage in activity, and they made it a virtual challenge. So we went from Enfield to Scaffold Pike virtually. It included digital technology to introduce that to older people as well, to reduce that barrier, because that's a massive issue. We still have to keep pushing that forward with people so they get used to doing things. They were receiving virtual postcards along the way to say, congratulations, you're doing really well. Here's a free tester of this. Here's a free taster of that. Come along to a free session. Here's a voucher from food, whatever. It included lots of health and wellbeing benefits along the way to encourage people. And the emphasis was of having 2 people to motivate someone and motivate yourself. Made us all very competitive, actually. I don't think my dogs walked so much in months for us to achieve what we needed to in a very short period of time. But it was a trial. It was a very cost-effective trial, and we're going to run that again. And that came from very innovative GPs. So there's lots of people out there trying to push this forward. And the social prescribing movement in London is very good. Our colleagues in Waltham Forest and Barnet are doing some really fantastic stuff. In Enfield, we've got 6 walks. We have about 120 participants. And even during lockdown, they were trying to walk even when they were supposed to be at home. So you can't kind of stop people from walking. The walking's very much there. And the health walks and talks, which are for all abilities, all disabilities, they're there. There's a range for everybody. I mean, some of our country walks are miles. So I think it's there, and I feel that there's a real appetite for it in London as well. Thank you.
Well, I commend those excellent GPs who do that excellent work, and I can call them our professional colleagues. But there's another colleague of mine who wants to come in very quickly, Andrew Boff.
Just on data, Dr. Norman, you've explained that, you see, we've got the figures of the actual physical activity is lower, and there's actually, the peak was 2014-15 in front of it, and you're saying that people, and this is where I'm confused, you're saying that people are more active, but because of that travel-related walking and physical activity, that explains the reduction of overall physical activity. Is that what you're saying? Because basically, if you could share with us that data you quoted about actually people are walking more, it'll give us some context to the data that we've got that says actually they're walking less.
So just to clarify, overall, physical activity is lower. It's a real crisis. That's why we have a physical inactivity crisis. Levels of cycling has increased in recent years. Number of people walking during the pandemic, which I was specifically talking about in answer to that last question. We've seen the number of people in Londoners choosing to go for a walk increase. But my point was that one of the reasons why there has been a drop overall within the pandemic is that a lot of active travel is generated as stages of a public transport journey. And as those public transport journeys have dropped, those active travel stages have therefore dropped. So the number of people who have been...
You don't need to go through it again.
Does that make sense?
Yeah, you don't need to go through it again. I just want to see that data, that's all.
I'm really happy to share that data.
But thank you very much.
Yeah.
Thank you.
Thank you. We'll arrange to get that shared with the committee. Thank you. So I'm going to have to move on because...
I'm about to go on to the next question.
Yeah.
Sorry, I just wanted to... It's coming after Onka. And it was specifically just on the question that Onka asked. I don't think we'll answer entirely.
Onka's on the flow, so let Onka finish and come in afterwards.
This is always a problem when you let a colleague come in. The other thing I want to talk to you about, Vicky, about the Mayor's Health Inequality Strategy, Implementation Plan 21 to 2024, which contains a commitment that by 2041, all Londoners will do at least the 20 minutes of active travel each day that they need to stay healthy. How does the Mayor intend to meet this target, and how are you measuring the journey on that target?
So I'll share some initial reflections. So I think as we've just had the conversation about the ways in which this measure is tracked through survey data and getting a rich picture of what that means from an inequalities perspective is really key. So the reason why it's such a prominent part of the health and inequality strategy in the first place is the contribution that physical inactivity is making to health inequalities in London. So there's population benefit as a whole, but actually by reaching all Londoners, this really will make a huge difference to narrowing health inequalities in the borough. Now, COVID has added a layer of complexity in understanding population level data that we are working through, and actually the fact that we have data at a London level from a regional transport authority where we can understand changes in patterns of travel choice, for example, to understand survey data, it puts us in a very kind of strong position, I would say, but it is still complex. And the challenge that I set out before from a health inequalities perspective, when we need to think about access to active travel for people with protective characteristics, including disabilities, age, whether that be young age, older age, and frailty, and the social determinants of health. What is your neighbourhood like in which you're interacting to be physically active? And the clinical elements of this, the health and care elements of this, of people with long-term conditions, with a cancer diagnosis that are recovering, and the particular challenges that they face. This is a directional target that I think is proportionate to the benefit that a more physically active city will give us. I'm going to hand over to Will a little bit to just talk about the nuances of how that's being monitored as part of a target, which is being led through Transport for London.
Great. So
the stage is laid for you, Vicky.
The stage is laid. Yeah. So overall, the sort of healthy streets approach that we are taking is a series of policies and strategies to create a more inclusive and city where more people choose to use walking, cycling, public transport. There are, the way that there are targets embedded within the Mayor's transport strategy to address that, both in terms of an 80% mode shift, the Vision Zero goal to eliminate the number of people killed and seriously injured on the roads, as well as a goal for everyone in London to do 20 minutes of physical activity a day. Now, not in one chunk necessarily, it could be be 2 times 10, equally beneficially, which is, why this active travel piece is so important. How are we delivering that, which I think was part of your question, is through how do we actually make our streets safe, attractive places for people to walk and cycle? We've heard about some of the barriers in terms of pavements, in terms of and in terms of block curbs and that sort of things, in terms of what do the streets look and feel like. One of the reasons why we've taken the approach that we have, it's a holistic approach. So if we put in a bike lane, we also look at the pedestrian crossings, we also look at the curbs, we also look at the pavement standards, and I can certainly give examples on that. But it's not just about the streets, it's also about that network and how you connect up across the whole transport network to enable more people to be active. But it's hard enough retrofitting this into a city that's been designed for the car for decades and decades. And in many cases, some of these are medieval streets. It's not a wide Parisian boulevard where you can suddenly fit in all these things. So this is a real challenge, retrofitting in it, but it's so essential that we make sure that this approach is embedded in the new development. So that's why it's so important that this same approach is embedded both across all the different all the different mayors' policies, both in terms of health inequalities policy, transport strategy, environment strategy, and the London plan, of course. So you'll see it consistently across all of that. Now, in terms of what actually changes, on the street, you're talking about the bike lanes, quieter streets, improved junctions, better pavements, pedestrian crossings, that sort of things. Also, how the street looks and feels in terms of speed of vehicles, the safety of those vehicles, as well as a whole series of sort of enabling interventions, like cycle training, the grants that we give to groups to enable people with, I went out with a group with people with mental health challenges or feeling and well-being issues post-pandemic for walking. Now that's funded through us. I think Alan touched on some of the issues around modified bikes for people with disabilities. Again, that's one of the things that we can fund through our training piece. So we've got how to do it. How then do we do the measurement of this? There are those targets. Then we regularly report against those targets in what's called travel in London, travel in London. It's a regular report. Actually, I think it's on page 85. I was just looking. That's where you can find the stuff about the walking, the pandemic, and then also the cycling pandemic in the last one, which is published last year. But that then is obviously the piece which sort of tracks progress against that range of indicators. But it's also about measuring what we actually do. So the distance of cycle routes, the amount of low traffic neighbourhoods, how many school streets, what proportion of our streets are then 20 miles an hour. And then measuring, well, if all of that activity is driving change, well, what's actually changing? The cycling numbers, we measure the mode share, we measure, sadly, the number of people who are killed and seriously injured across that. So there's sort of various tiers of what we're doing, and there are various measurements that then reflect those tiers. Does that provide...
Yeah, I think so. Thank you very much. Thank you.
Thank you.
Back to you, Chair.
Thank you. Emma, very quickly, but can we have the answer in a minute or so, because we're massively over time?
Yeah, it was because, just to bring it back to that government pilot around socials prescribing, which has been 13 million, I think it's about 11 authorities, and Onka asked what you were doing about that trial. So did you write to the government to be included on that trial?
So, as from a walking and cycling transport perspective, I didn't. Maybe Katie can come in on this, but I know that the Mayor has got the toolkit for social prescribing, but Katie might be closer to that in terms of the detail, because obviously it's not a transport issue per se. Obviously walking is part of the programme in different parts of the city.
Apologies. So the Mayor produced a social prescribing toolkit for social prescribing link workers.
I'm just sorry, just to be very clear on the question. There's a government trial. They've given £13 million to 11 local authorities. I think Onka suggested London had been left out, and then you did follow up and say London's being treated differently. So I want to be clear. Did we write and ask to be part of that trial?
I didn't.
I'm not aware that the Mayor wrote for that. I think it was local authorities applying for the funding.
I think that's clarified. Thank you.
Great. So I'm going to move on to Assembly Member Russell.
Thank you. It would be useful to understand whether the government made it available for London, if it was only for local authorities, sometimes London is treated differently. So it would be, if anyone is able to follow up. Or Vicky, do you understand? Do you have any on?
I was just going to say, I can follow up the question. I'm happy to pick that up on behalf of the committee. I think just to finish off what Katie was saying, there has been London work to produce resources in London around social prescribing through the social prescribing network that's been described. So we're confident there is a level of guidance,
The
etc.
question was the London, were we asked to be part of it or not, right? Or did we apply for it? I know the mayors are responding, but the question I was making...
And I will take that away. Thank you.
Anyway, look, you're all speaking without your microphones, which is extremely naughty, and I'm going to pick up the questioning again. So my question is for Will Norman, and it's about the evidence-based indicators for the Healthy Streets approach. And I'm just wondering how the Mayor measures overall progress against the Healthy Streets indicators, and what progress has been made since the Healthy Streets approach was adopted.
Thanks. So there are 10 Healthy Streets indicators. So that includes everything from... They're essentially a toolkit for designers. When we look at every single street which we're doing a scheme on, we will run that through those indicators. Now, the indicators are things like that pedestrians from all walks of life are on that street, the street's easy to cross, that it's safe, that it's not too noisy, there are places to stop and rest. And I think why this design check is so important is going back to a point that was raised earlier about the pavements, that when schemes are invested in, for example, low traffic neighbourhoods, I think Emma raised, or cycle lanes, it's not just looking at that single intervention, it's actually looking holistically, because there are these indicators for each and every scheme, which shows actually how does this benefit the entire street in its holistically. So those indicators are measured they're a design tool for each and every scheme. So every scheme that we come forward with and fund will go through that process of monitoring that. What it is not is a sort of an aggregate point, which then says, well, actually, if all the streets in London, how many are, have got these factors? Because they're a design toolkit for the designers on that scheme. The way that we then look at the, there are then as I said, if there are then other toolkits to check all new schemes. There's not just the Healthy Streets, there's the junctions, and it's part of that suite of design toolkits. In terms of the overall measurement of then how does this all stack up, I come back to what I was talking about earlier on those overall targets of 80% of all public, the MTS standard on 80%, eradicating the deaths, to the 20 minutes of walking and cycling. And again, that gets published in the in TIL, and then there are the outcome measurements in terms of how many people are cycling and how many people do that. What we are not doing is measuring every single street in London against those indicators and then aggregating that up, because frankly it would be so hugely expensive to do that. What it is doing is saying, right, these are the interventions that we are doing. Does the intervention moving forward meet the requirements on those Healthy Streets indicators? And therefore that street or that intervention or that junction or that cycle lane brings that street up to a level which meets the requirements and the quality check. So it's not those indicators are not a pan-London piece, I suppose I'm trying to say. It's an individual scheme piece, and then where we select a scheme intervention for whatever reason, whether it's a safety issue or demand issue, that's where those changes will come in.
So my understanding is that in 2016 there was a commitment to use the Healthy Street check score for every consultation, and to look for a percentage uplift in terms of the scores that were coming out on the designs, as a means of trying to drive improvement and to reduce the serious risk issues presented in some designs, and try and design those out. And I think the Healthy Street scorecard was kind of dropped during the pandemic, and I just wonder if you're publishing those scores as a way of kind of driving improvement.
Yeah, so those scores are for permanent schemes. Yep. So where we are doing full schemes, and so for example, can see the work on Jamaica Road, for example, as part of Cycleway 4, or it's a very good example. I cycled down it the other day. You can see, and I can share those checks with you on those. Where there were temporary or emergency measures during, for example, the ones during the pandemic, there weren't those checks because the scheme is a temporary one. As we begin to replace those with permanent schemes, there will be those Healthy Streets checks, and really happy to share those with you on a scheme-by-scheme basis.
That would be great. Just in terms of TfL and the kind of understanding within TfL of the importance of some of these things that seem quite minor in the Healthy Streets check score, you know, making sure it's possible to cross the road, the kind of dropped curbs, the kind of designing out the danger. There's a slight impression that kind of the senior levels within TfL are very familiar with how the tube runs, but possibly not so familiar with the experience of particularly cycling on street. Now, I just wonder how many of the kind of, you know, are you aware that senior people within TfL are cycling regularly so that they understand the dangers that people are being exposed to?
I think that probably would have been a fair criticism of TfL several years ago. I don't think that is quite the case now. I don't think every member of the senior management team in the Execco will be familiar with the intricacies of the Healthy Streets indicators, but that, as I said, is a design tool for designers. I think for the focus on why this is so important, why it's so important we make our streets safer, why we encourage and enable more people to be active, I think that is universally felt across all of TfL. I know it's raised and discussed in Exco at board meetings, senior management meetings, etc., etc. In terms of how many cycle, I don't know that off the top of my head. I can tell when colleagues come into meetings and they may be a little bit damp, or they are still putting their cycle helmet to one side. You can tell that they are. I know that the Commissioner, Andy, is really enjoying his electric Brompton. I think you've got one too, and he went out on a tour with London Cycling Campaign, actually looking at some of the sites where there have been fatalities in the past. I know I'm not going to go through every member of Exco and tell you what bike they've got, but you know, there is I think that there is a not in terms of necessarily who's cycling, but a cultural shift in terms of the whole organisation recognising why it's so important that we look at the safety and the infrastructure on our streets to make sure that this change is happening. And it's not entirely disconnected from the tube. You know, going back to, if you've got a safe route to a tube station with drop curbs and good pavements, then more people are more likely to use the tube. Similarly, a bus stop. Or if you've got secure cycle parking at a tube station or a train station, then you're more likely to use that as a facility. So it actually, you know, it's as I've said, it mutually enhances the entire business.
Thank you. The Mayor and TfL's Walking Action Plan and Cycling Action Plan contain several areas for action to reduce barriers to active travel. What progress has been made in implementing these actions, and how are the health benefits of these actions measured? And that again is for Will.
Yeah, so there's the Mayor's Transport Strategy, which sits above, which sort of defines that thing, and then there's a series of daughter documents, or son documents, such as the Cycling Action Plan, the Walking Action Plan, the Vision Zero Action Plan. Now, those are the MTS is the sort of 25-year strategy up to 2041, but we've got to keep those plans, the action plans, sort of live documents. They're changing. You'll know we've re-released the Vision Zero plan. We're in the process of redoing the Cycling Action Plan, but we are achieving some of those goals. So, you know, in terms of cycling, I think since March 22, we delivered at least 120 kilometres of new and upgraded cycle lanes. The cycle network of London now reaches 19% of all Londoners, which I think was in 2019 was about 12% of Londoners. We've got, I think we've delivered over, how how many, I can't remember off the top of my head. We funded, I think TfL has directly funded about 4,200 sort of bike parking spaces in hangars. There is again, all of this stuff is detailed in the transport in London, travel in London data. On walking, part of that is that one of the key targets within the walking mode was walking to school. And I think, we talked earlier about the life course. It's so important that we get people active at an early age. All the evidence shows if you get people active early in life, then they're far more likely to be active throughout their lives. So school is a really important piece. We heard about some of the dangers around schools in terms of cars and parking and road danger and pollution around there. So one of the targets we had was to increase the percentage of kids walking to school. And now we beat that target 2 years early in London, and so we've had to extend the target to 60% of all journeys being walking to school. I think one of the challenges, and it's picked up earlier, was that I think that in central London, you're seeing the changes of the investment that we're seeing. I think in inner London, we're beginning to see some of those changes. So inner London being those boroughs like Hackney, Southwark, Lambeth, Camden, Islington. And I think, as someone alluded to earlier, it's very different in outer London, and I think that is really where there does need to be a concerted effort. We've shown in some parts of London, and working with those boroughs, just how things are possible to drive that change. And there's some really good examples of that. But I actually think that that's the next big challenge, is how we move forward on that. Sorry, back to your question. Got slightly sidetracked. In terms of the progress, in terms of sort of deleting those barriers, in terms of changing infrastructure, that is happening. And as I alluded to earlier, we are seeing the results of this change. So, for example, there has been a shift in the percentage of journeys cycled. The last data was on 2020, so that's up from 2.3% of all journeys up to 3.4% of all journeys. During the pandemic, we saw a mode shift double for cycling in those areas. I think we're on target for meeting some of the targets on the uplift of cycling. We've also seen the diversity of people cycling beginning to uplift. So we're making progress, but if I'm completely honest, there's an awful lot further to go, an awful lot more to do, and I think it's becoming more urgent than ever that we keep going on this.
Absolutely. Vicky, you wanted to come in.
Just very quickly, when we're looking at health interventions at population level, tracking this right through to the kind of health outcomes that we're interested in about preventable disease, disability and mortality, that's a long causal string. So Transport for London is a strategic planning authority for London, and understanding at that strategic level what's happening is important. The strength of the evidence on physical activity, I think we can be really certain about. So Jerry Morris did the seminal studies decades ago that actually started with looking at difference in health outcomes for bus drivers and bus conductors, then looked at the difference between postmen and post office staff, civil servants. So the solidity of the evidence on physical activity is there. How we deliver it and how we track that in London is important. And the final point is a lot of that is delivered through local government, through local authorities and local action. And the understanding of those inequalities is also very local. So that is really important, the function that local government plays in this, through health and wellbeing boards, through their local travel plans, through local councillors, flagging risks and issues for the communities that they're serving, really important. And final point, work from Manchester recently about devolution, and that ability to drill down at the local level and how important that is really important. So given the complexity of London, we need the strategy and the clarity of the evidence, but we also need the clarity of delivery at a local level, if we're going to tackle inequalities.
Yep, thank you. So just sort of slightly summarising, we've got a sort of bottom line of it's really important that everyone's doing 20 minutes of physical activity every day, and at the moment not enough people are doing that, so we need to get more people physically active. And it seems like the majority of possible walked trips, we're managing to kind of maximise those through trips connected with public transport. So would I be right, Will, in saying that the biggest potential for increase in physical activity is through enabling more cycling? That's just a yes or no.
No, I think there is potential on both. I'm not saying that we've reached the maximum for walking by any stretch of the imagination, and I think there is actually, I think walking is an awful lot more accessible for a lot of people than cycling. I think cycling provides the greatest, I think cycling and buses provide the greatest transport solution in comparison to the private car, which, as I mentioned, generates the smallest amount of physical activity.
Yep.
But there is a huge amount. The fact that 250,000 car journeys every morning of the school associated with the school run, many, not all of them, and I totally recognise that not every trip can be walked or cycled or scooted, but there's huge potential to continue that change, and that's why it's so important that, you know, this is not just a cycling discussion, this is walking. And by walking, I take Alan Benson's got a brilliant colleague called Katie Pendrick, who talks about walking and wheeling in the same piece. And by wheeling, I mean people using wheelchairs in terms of that activity.
Yes. Sarah.
I'm sorry, just very briefly to come in on that point and just to confirm from a health point of view, actually kind of the benefits of walking versus cycling are arguably greater in terms of a health benefit. And also from an accessibility point of view, a lot of the people we're talking about who are incredibly inactive, we're talking about very small changes in terms of their health behaviour and the way they live their lives. So the concept of doing a sort of even a 10-minute cycle ride might be far and above of what's realistic for them. And I think we just need to be mindful that we're talking about very inactive, sedentary people, and we need to meet them at the level they're at, and actually thinking about incorporating more walking in their lives is likely to be more realistic.
Yep.
So, Assemblymember Russell, before you continue, I'm just going to sort of insert a time warning because we were running massively over. So if on the questioning as well as on the answering, if we can be briefer and to the point, that'd be great.
So I understand that the DFT guidance, LTN 120, says that reducing the speed and volume of traffic is one of the best ways to increase the likelihood that people will walk or cycle. And one of the recommendations in the Hostile Streets report that that was in the last term of the Assembly was that we should be getting 20 miles an hour onto as much of the TLRN as possible, and also that when ordinary bits of roadworks were done, that there should be that opportunity to reline roads that were designed originally for 40 miles an hour, now have 20 mph limits, but they still have the lines on them that suggest that they're a 40-mile-an-hour road. And I just wonder, Will, are you maximising the opportunities both to roll out lower traffic speeds and also to use those opportunities of ordinary everyday roadworks to make those roads feel like places where people are, you expect, if you're in a car, you expect to see people walking and cycling?
Yes, so the expansion of, I think, well over 50% of London's roads are now 20 miles an hour. We're seeing an increase, and we're accelerating the work on the suitable parts of the Transport for London road network where there is 20 miles an hour. Not every area is suitable for 20 miles an hour. There are bits of the sort of, the North Circular, which probably wouldn't be suitable, bits of the A12 which wouldn't, but where they are suitable, it's exactly what we are doing. In terms of the sort of expansion of those roadworks, I think one of the things that constrains that is the budget. You know, the more you do we've got limited budget for road maintenance anyway. It's vital that we don't have our core infrastructure falling apart. We know that potholes are bad for everybody, irrespective whether you're walking, cycling, wheeling, driving, whatever. So we need to make sure that the roads are safe. And where appropriate, we can make changes to the wider road network. But to do that on every set of roadworks would massively put up the cost of the roadworks and really diminish the ability to keep the assets maintained, which is why we've got a separate budget for the 20 miles an hour work, in addition to any change that can be made at local spots where work's going on.
Thank you. And then how does the Mayor coordinate work across London boroughs to implement the Healthy Streets approach and active travel schemes? And what level of engagement is there with all the boroughs?
So I think this is absolutely essential. The boroughs are absolutely critical partners in delivering this change. London's got 95% of London's roads. The Highway Authority are the boroughs. So to do this just with the 5% that the Mayor and Transport for London control would never deliver anything. And I keep saying that point that was made earlier, that if you could invent a drug as powerful as physical activity, I would have Nobel Prizes up to my armpits. And conveying that importance to cabinet leads for transport, the fact that I think that many of those cabinet leads have more power over the health outcomes and ability to address health inequalities than the Secretary of State does in terms of that level of intervention for prevention, in terms of providing active travel, reducing road danger, in terms of cleaning up the air. So the councils are absolutely core partners in this. So the Mayor's Transport Strategy sets out the plan for London. Each borough then has its local implementation plan, so how it will locally implement that Mayor's Transport Strategy. And then Transport for London provides funding for those programmes. So as part of that funding, schemes are approved or they're not approved according to whether they're meeting the outcomes set out in that piece. That funding supports things like bike lanes, pedestrian crossings, pavement upgrades, low traffic neighbourhoods, cycle parking, school streets, or a raft of different things, as well as the road maintenance and asset maintenance. And then we shape how that money can be directly spent in terms of that coordination through a raft of different strategic analyses. You might be familiar with the strategic cycling analysis, which is setting out where the priorities are for that. We also have a strategic walking analysis, which shows where there are hotspots and crowded pavements that we've touched on before. That information helps coordinate where there is most need for the boroughs to focus their attentions. There's all that analysis, there's the guidance that sits behind that, which we provide to the boroughs. And then in terms of that coordination, I know the mayor, the deputy mayor, myself meet the borough leaders on a really regular basis, whether that's the leaders of the boroughs or the cabinet leads for transport, so those people who are most responsible. There's the London Council's Transport and Environment Committee, which we meet with the TfL has representation there, so that helps coordinate the efforts at a pan-London piece. And then every borough has a liaison officer within TfL. So each borough knows exactly who to speak to, because TfL is a big beast with lots of different sort of skills, assets, but also silos, let's be honest. And actually that liaison person is the key point person for those boroughs to help navigate the Transport for London sort of working environment too. So that's how we sort of help coordinate this across the boroughs. But obviously boroughs have their own priorities, and that's why it's so important that the local implementation funding is back in as part of this new deal, rather than everything being sort of dictated to the boroughs, because it has to be, they know their area, the boroughs know their areas best and what interventions need to be shaped, but we've got the strategic analysis, and where those two fit together, in theory, you get a perfect plan.
Thank you very much, Chair.
Thank you. Going to move on to Assembly Member. Oh, Alan, you want to come in?
Very briefly, before we move on, Will talked about design standards for streetscapes. I think it's worth noting that there is no perfect solution. So different aspects of the streetscape can have conflicting effects. So, for example, tactile paving, essential for blind and partially sighted people, very uncomfortable for wheelchair users like me. So it's worth noting there isn't one solution. The City of London has done some good work developing a tool that allows you to balance the conflicting needs of different users. So it's worth looking at that for anyone that's interested.
No, thank you. Glad you mentioned that as well. Difficult with a buggy as well, I can tell you. Emma?
Thanks, Chair. And just interestingly, on Alan's last point, I think the Healthy Street Scorecard was released there, and City of London came up as the worst borough, I believe, in London. So interesting that perhaps there's some things that we need to learn from the still. But I just need quickly to touch back on the 10 evidence-based indicators that Caroline mentioned, and hopefully it'll be a quick question. But yesterday the Mayor tweeted that air pollution or pollution in London is now the 18th worst city in the world, which is clearly concerning in relation to it being appealing on that clean air measure. Where does that source come from? Maybe looking at Vicky and Katie. I was looking all last night and this morning.
I'm happy to take that away and confirm. I don't know offhand.
Katie?
Yeah, I think we'd need to check that one. I haven't got that at my fingertips.
Will?
I imagine our colleagues in the environment team would be best placed to get that data, but we can certainly supply it with you.
Okay. I'd hope that would be something that has been released, that had been briefed well to the team, because that was really quite a shocking measure that we've fallen to 18th when we've been the 150th in the past in terms of pollution. So
I think it really shows why this is so important and why measures things like the ULEZ, the expansion of the ULEZ, changing our streets is so important. And I think you're right to pick up that this is, we're running to stay still in many of these cases, and that's why all of these policies fit together and is so important for London's future.
Yeah, so it'll be really interesting when we get a source for that, so thank you. Coming back, I think, onto one of the other key indicators, which is safety and people feeling safe. Obviously, since January 2017, possession of weapons, sexual offences and violence against a person has risen by 42%. So on that, how within this conversation can we even begin to tackle the failure since 2017 to tackle crime in London?
I'm not an expert on the crime in London side of things. I can certainly talk about it in terms of safety for people walking, cycling on our streets, and the crucial piece of the partnership with the Met and the work that they do. But in terms of that overall crime piece, it's rather an issue. If I'd speak to some of the colleagues in MOPAC and the Deputy Mayor for Crime on some of those side of things.
Is there much investment in your schemes from the Met and MOPAC?
Yes, there's a huge amount. So we, so part of Transport for London funds what is called the roads and the roads policing. There's our roads and roads and transport policing group within the Met. So that's a 70-something million pound investment in terms of the policing of the police's transport, the streets, the bus networks on our roads. And that will involve policing speeding and some of the road safety pieces, but also looking at violence and antisocial behaviour on the bus network, on the streets as well. So that core piece that TfL provides funding for is absolutely essential in terms of supporting the Met, in terms of policing the surface transport mechanism. Then there are obviously colleagues with BTP who police some of the...
Sorry, this is my fault. I should have been more specific. I meant in terms of the projects for walking and cycling. Do you...
Oh, sorry.
Sorry, that was my fault. I should have been... On those schemes, do the Met consult with you? Do they tell you that the schemes have been helpful in, reducing crime, antisocial behaviour, that sort of thing?
So the Met, for schemes, particularly the permanent schemes, but actually during COVID, all the transport things, the Met were consulted as statutory consultees, and we would meet with the Met, as well as ambulance service and fire, on a 2-weekly basis to go through the schemes and any issues that were raised, both in terms of movement of emergency vehicles, but also other concerns, as you rightly point out, in terms of crime and antisocial behaviour. It's one of the indicators within the Healthy Streets score, the 10 indicators. So, for example, where we're building cycle lanes that are maybe not on the road, the importance of lighting and CCTV in terms of providing that safety network. So if you cycle along the Greenway at the moment, which goes from pretty much from here to through Newham, there is those facilities are there, which was done jointly with the Metropolitan Police. And then when there are issues that are reported, the Met come in and they've been policing that, and they've been very effective at reducing the crime and antisocial behaviour along that particular cycle route, for example.
I think that's a really good argument that isn't shone light, isn't given enough attention. So I'd be really interested in those.
I'm really happy to come out. If you fancy a bike ride, I'll show you some of the stuff and introduce some of the police who've been doing it, because it's a good approach.
Oh, yeah, I don't know about the bike ride, but the stats would be interesting.
We can walk. Physical activity.
We can walk, definitely.
Exactly.
I'm no good on a bike, but we can walk. Thank you. And so we're coming back to you again, please, on just a question around how the Mayor assesses and measures the health benefits of TfL-funded programmes such as Livable Neighbourhoods and Street Space for London, and what impact these programmes have had in relation to everyday physical activity.
So this, again, goes back to the point of how we measure what we do is we measure the investment portfolio, we measure the outcomes in terms of the kilometres of bike lanes, the number of schemes, etc., etc. And then we measure, well, how many people are using them. So, for example, in a new bike lane, you'll track before numbers and then after, looking at an increase, for example. Been looking at walking measurements and looking at changes in behaviour associated with those schemes. But also there's a Pan-London survey. I think we've historically been much better at looking at cycling data. It's easier to count. Tackling pedestrian and understanding the numbers of people walking in London is trickier. But I'm really glad to say that we've now got these new fancy cameras, vivacity cameras they're called, but they've got use artificial intelligence, so those can actually play a really important role in looking at the pedestrian increases and pedestrian counts, which help inform schemes. Some colleagues mentioned the importance of wider pavements in places where you've got particular crowding issues, etc., etc. So there are then individual schemes so looking at the actual numbers associated with the individual schemes. There is then a Pan-London annual count. So, for example, there is I think 1,500 cameras and measurements go up across different points within London that then get measured. For example, the cycling data that gets fed into the Transport in London report, which is published annually. That data then reinforces some of the strategic guidance we've got, which I mentioned, the strategic cycling analysis. We did that, I think, in 2017. We asked for that to be done to sort of steer where do we prioritise investment. That needs to get refreshed with that information, which then goes back to the boroughs and shows where the priorities are in that. So you've got the approach of getting that number. And then, as Vicky said earlier, how you then equate that to the health benefits is associated with the really brilliant data sets that exist in terms of the benefits of physical activity. And if we're seeing those levels of physical activity increase, then we can then say, well, actually, if X number of more people are cycling in this area because of this intervention, it is likely that over time there will be these health benefits according to that really substantial sort of medical database. What we don't do is do that ourselves as Transport for London. We'll measure the outcomes of our schemes and then use those outcomes to equate through all the medical teams and the public health teams to show, well, what are the wider public health benefits? But obviously, public health benefits take a bit of time, as Vicky said, to manifest and show up in the data, given the scale of things that we're talking about.
Thanks. And again, what schemes or initiatives does the Mayor have in place to reduce barriers to physical activity for Londoners who are unable to walk or cycle?
Yeah, so the whole of this strategy is trying to enable and encourage everybody to walk and cycle. And as I said earlier, when I talk about walking, there is also that by association, that is the wheeling. It is not just people who are, it's not just people who are walking 2 feet, but wheeling in wheelchairs and the benefits that bring. Most people in London can walk and do walk. I think even 81% of disabled people in London walk at least once a week. 3/4 of disabled people in London are able to cycle, but I recognise, as Alan pointed out, that is not meaning people with disabilities are far more likely to be inactive than those people active. This comes back to the point of sort of sport and sort of advocating for sort of Tour de France style cycling is not the answer here. There is a sort of, we need to make sure this is accessible to everybody. We did a really good study, which was a qualitative study of people in outer London a few years ago, 2 years ago. So just before COVID, which looked at actually taking 50 people and setting them the challenge, how would you put 20 minutes more physical activity into your everyday lives? And we tracked them with diaries and journeys. And it was really interesting the ways that they came about, the ways that they did that. And a lot of that was about getting off the bus a stop earlier, was about going out for a very short walk, particularly those people who are most inactive. And I think that's the group that we need to really focus on, those people, the most sedentary behaviour. And that's why walking and walking is an accessible mode for a lot of people there. But it's not just about, there's obviously the infrastructure that I've talked about at quite a lot of length in terms of changing our streets so that they are friendlier places for people. They do enable more walking and more cycling. But that adage, build it and they will come, is true up to an extent, but not everybody comes. And I think, to your point, how do you get those people who are not walking, cycling, or don't feel able to? How do you do that? Well, I think that's so important, why there are then community programs to reach out to people. We've got the walking and cycling grants that we've partnered and expanded in partnership with the London Marathon Charitable Trust. Those are small grants that sort of up to £10,000 to small community groups. They, for example, are small walking groups of people with dementia. They are sort of cycling groups for people with older people. They fund cycling groups, the Wheels for Wellbeing, which is a brilliant programme for people, to enabling people who maybe don't think they could cycle to try an adaptive bicycle. There's one at Herne Hill on a weekly basis. There's another Cycle Confident do a similar thing in Victoria Park on a regular basis, just to get people to try these things and build up that confidence. So those grants are absolutely essential, not just for people with disabilities, but also that perception that this isn't for me. So there have been an issue with sort of some of the black and minority ethnic communities feeling that this isn't for them. It's a brilliant scheme that was funded originally through this called Cycling Sisters. They've reached out to women in places of worship and mosques as family fun days, and they've had a huge uplift in the number of people who are cycling. Previously thought this is not for them in any way. So the infrastructure has got to be coupled with the sort of the enhancements, and that includes things like cycle training for kids and adults, which I'm glad to say is free in London.
Thanks, Will. Just coming back on, I think the walking and cycling grants sounds like it's doing fantastic work. How much money in total every year is spent on those?
I can't remember off the top of my head. I will get back to you on that with a full amount. I can't remember the total on that.
This is is there a ballpark just to have some sort of idea? I mean, are you talking millions or hundreds of thousands?
We're talking. So I think. So I've got to. So please don't quote me on this. This is ballpark. I'm conscious that. So I know that they're about. They think they're £10,000 grants. So last year there was. I think there were 130. Not last year. This year there were about 130 grantees. My maths isn't quick enough to figure that out. But then it varies on year by year. So it's not insignificant, but obviously it'd be great if there was more, and that's one of the reasons I've sort of asked if we could partner with another organisation that has similar outcomes, and that's been great that we've got. London Marathon Charitable Trust have put in £2 million, which has matched the TfL contributions as well in there to make that go further.
Thank you.
I see you using your calculator.
I am,
so your maths.
Do you know what? So I've done the maths in my head, but I also want to make sure that
I'll give you the proper
figure
wrong. Rather than my my sort of slightly dodgy guess.
Okay. And coming on to question 10, what are the implications of the latest Transport for London funding settlement for active travel schemes in London?
So the implications are, significant. I'm really pleased we've got a longer-term settlement. Everybody, I think, shared the problems of sort of moving from week to week without a funding deal. So the deal has been fixed. It provides us some significant, but as everybody said, there's a significant funding gap. In terms of spending on active travel, before COVID, the sort of average spend a year in London was about £230 million. Which included money going to the boroughs. Within this funding deal, there is 80 million for capital spend, which is largely TfL, and then there is 69 million spend for the boroughs. Now that's 44% less, if my maths is correct, or 40-something% maths, 40-something% less, which undoubtedly is going to have a significant impact. It's less than what we have been spending historically. But what I've been talking to the team within TfL and within the team within the boroughs through all those meetings that we do is actually we can't just go back to doing less and doing the same as things that we used to do. We've got to be thinking differently, and that sort of cliche of doing more for less is actually possible. So there's sort of, if you want to hear, sort of 5 things that I think we can do with that funding to make it stretch further, if that's helpful. Yeah? Very quickly. Okay, so
I think it's great pressure. Yeah,
so it's going to have a big impact. Yep, but we can mitigate that impact by, first of all, with low traffic neighbourhoods and some of the changes that have happened to London's network, we can use the quieter roads that now exist to signpost people through. So I know people living some of these networks and in some of those boroughs that have them know it because they live there, but actually going from one town centre to another town centre, having wayfinding, which is sort of signs and lines on the street, and then managing the crossings across major roads is a relatively cheap way to make the most of the infrastructure that we have been putting in. Secondly, we've proven that we can use temporary and sort of cheaper materials. So in an ideal world, I'd love to be rolling out the cycle lanes with sort of York stone and granite. But actually, when you look at examples like Mansell Street or Hammersmith Gyratory, we can do an awful lot more. Hammersmith Gyratory, I think, was originally costed at something like £15 million. Being able to deliver that under constrained funding was less than £2 million. So we can make things stretch further. There are some things which can't be done like that. There are major junctions, Hobart and Gyratory, which sadly have been seeing a lot of fatalities. There have been pedestrian fatalities at some junctions, for example, at Mile End, where we really need to relook at the whole junction and make that safe for people. That can't be done in temporary materials. So if there are those spaces which really can't, and they are sort of collision hotspots and not safe, then that's where we need to invest that work in the permanent measures. And then there is actually how do we leverage partnerships in a better way. So I think historically TfL doesn't necessarily use partnership funding and things like Section 106 and community, the SIL, the Community and Infrastructure Levy, in a more strategic way, which we're beginning to in a better way. So for example, outside this building, the bike lanes that will come on North Woolwich Road are funded through the development, some of the development contributions from the expansion at Royal Docks. You can see the same thing happening in Nine Elms. So there is I think there is a challenge for all of us of knowing, we've heard how important all this is. It's never been more important. And we talked about the other co-benefits, but we've got less money. Therefore, we need to think differently about how we're going to deliver things for the future.
So I'm guessing if somebody said to you, here's £200 million, what could you do with an extra £200 million on top of what you've got already? How much could you do with that?
It depends on what it is and where it is, but £200 million would obviously go a long way.
And it would do, great things to get people walking, cycling, improving transport for all across London.
That, undoubtedly, an extra £200 million in terms of active travel would be excellent.
Okay, so what comparison that was done in about expanding the ULEZ to the whole of London in comparison to spending that money on targeted measures to help improve people getting out of their cars, walking and cycling more? What comparison was made between giving that money to your team or instead expanding the ULEZ?
Well, it's not, as we went back to your question earlier about London dropping down to 18th in the air quality piece. To tackle these things, walking and cycling in its own is not going to tackle that. It needs to be a coordination of measures. I look at the issues around school streets. We're great at cleaning up the air on some of the minor streets, but you need the ULEZ to be able to tackle that on the major roads. So this is about doing this together. So it's not an either or here. The ULEZ will help clean up people's air. We know that that's one of the barriers on people not walking and cycling. So therefore, expanding the ULEZ to those communities that don't have it, and as we heard earlier, Outer London is one of the areas that needs these changes most, is an absolute core contingent of a holistic programme. So I went back to the point around the healthy streets indicators and our whole approach being embedded in the environment strategy, the planning strategy. You can't do this in isolation. That's why you need these very range of different measures, because they all enhance each other.
So I'm sure you'll have read the report, which it shows that there's actually going to be very negligible impact on air quality. And actually, some of your schemes, I think, as you've been saying, have a really good benefit on air quality and can be very well targeted. So I'm just trying to get to the point of understanding, did you even look at how giving £200 million extra to your team and the Walking and Cycling Commission would be able to improve air quality as well? Or are you saying your schemes don't really impact on air quality as much?
I'm saying to tackle air quality in London, you need both to clean up the vehicles that are providing it. You need to shift people away from using vehicles full stop. Yeah, and that requires clean air zones, and they're proven to work. You can see the benefits. You can breathe the benefits every day in the areas which have them.
But of course, you've seen that in the expanded ULEZ for the London-wide, you'll have seen the report that shows that there's going to be a negligible impact on clean air within the outer zone, for example, in places like Croydon and Sutton.
So you will see in that report there are benefits to doing this, and I welcome all the benefits to cleaning up London's air, whether that's through mode shift to cleaner modes of transport or to actually making sure that people are driving non-polluting vehicles.
Okay, but I'm just trying to, because it's such,
I think I've been quite clear.
It's such a vast scheme of money, it's such a large scheme of money that I think it would be important to show Londoners that we'd looked into every single avenue to see what would be most beneficial for their health. And I'm not saying that you're wrong, I'm asking you what comparisons you have made, what you showed that you could do with that money, that actually it would be better to do the ULEZ, because Londoners want to see that comparison. Londoners want to know this is the best way to spend £200 million. So my question is not, is it the right answer? My question is, what working have you done to show that actually spending that £200 million within your department wouldn't have been as effective in cleaning up London's air?
So spending £200 million on walking and cycling schemes would not cover the same area that the ULEZ will do. It would not reach as many people, it would not reach as many communities, it would not reduce the traffic in as wide a piece. So the schemes that I do are very targeted on specific areas. Yeah? The ULEZ is a pan-London piece that will engage all sorts of communities. It's not fair that people living in inner London are benefiting from cleaner air because people are driving less polluting vehicles than they do outside. So my interventions are hyper-local. The ULEZ is a pan-London piece. We need both of those to be able to clean up London's air and make it safer and healthier for everybody.
I think it's a really strange champion, because you're almost saying your schemes aren't that effective. To me, it's a really weird argument, because I'm trying to ask for more specific examples.
What you're missing here. But we kind of need, my argument is we need both. We need to clear up.
Remember, Bess, I think I'm just going to ask you to move on, because I think the same answer has been given. It's quite clear.
I was going to move on then. Right. It was weird. If I was a cycling and walking champion for London, I think I'd give it a bit more oomph, but never mind. Moving on to next question.
Can we just be a bit more respectful to all guests, please?
Sorry, well, perfectly. Only in that answer, in the answer to that, I would have given it a bit more oomph as to what my schemes meant, because it did almost sound like you were saying they were negligible.
I was just addressing that particular scheme, but I could give an awful lot more oomph in terms of why low traffic
neighbourhoods are better. I don't think the chair would like us to.
Oomph I can provide. Pleasure.
For the interest of moving on, please go on to the next question.
Thank you. In your assessment, have low traffic neighbourhoods delivered their intended impact on the physical activity levels of all Londoners?
So brace yourself for some oomph. Yeah. There is. If you look at some of the low traffic neighbourhoods in terms of what's gone in, you look at first of all, they've had a range of different impacts, and they've been gone in for over decades. Low traffic neighbourhoods have gone in. So where I live, there was one that was a bollard went in the 1970s after a poor primary school kid was hit by a coal truck. There's one closer to where I used to live that went in to reduce prostitution and antisocial behaviour. They have a range of different outcomes. The ones that have gone in recently, often associated with reducing speeding, reducing toxic air, making the streets safer for walking and cycling, reducing congestion, part of the challenge of meeting net zero. They all do all of that. Low traffic neighbourhoods support active travel by making it safer for people to walk and cycle those short trips. Now, you can look at some of the evidence within the ones that went in 2020. You can see the immediate impact on that in terms of, from a health perspective, in terms of road danger. So those cut, and independent research by the University of Westminster cut the number of collisions for all road users, not just people walking and cycling, but also people in cars, by 50%. Now, there are very few other interventions that will lead to that level of reduction in collisions. It's difficult to assess the impact of the 2020 low traffic neighbourhoods in terms of physical activity because of, as we talked earlier, about the sort of unique circumstances of the pandemic. So I think it's more helpful looking at some of the more recently established ones, which actually genuinely show that they've resulted in a really significant change. If you look at the independent research that was done in Waltham Forest on the low traffic neighbourhoods there, that were which were much more holistic than some of the temporary measures that were put in during the pandemic. But if you look at those, you can see that on average, people living in those areas among residents did 115 minutes more walking a week in the low traffic neighbourhoods. Yeah? There was 20 minutes more cycling a week. Now, we've all heard today just what a difference that would make to people's lives. I go back to the 20% fall in all-cause mortality, the 30% fall in dementia, the 35% fall in cardiovascular disease, the 40% fall in type 2 diabetes. These are chronic diseases that are crippling the health service and making lives miserable. Now, low-traffic neighbourhoods are a great way of actually enabling more people to walk and cycle many of those shorter journeys. Now, we need to make those low-traffic neighbourhoods, particularly the ones that went in during the pandemic, those need to go beyond the measures that went in. And I think Alan and Transport did a brilliant report that really emphasised that actually a lot of the outcomes that these are achieving really do what disabled people want. But things that the stuff, that other things that need to change, like the drop curbs, like the pavement, like the other things like have been put in Waltham Forest really change it. So I can't think of interventions that deliver for physical activity more significantly than some of the low-traffic neighbourhoods, particularly if you look at the ones that have gone in over time, because that's where you've got the longitudinal data.
Thanks. Well, I'll just really quickly make the point on that answer about the horses for courses. And when you talk about Waltham Forest, actually, it's a very diverse borough. And the implementation you're talking about is in Walthamstow and in the south of the borough, very, very close to public transport networks, compared to the north, where there isn't those interventions, and it's a different kind of. So that's just when we talk about data.
I would agree with that, and I think that's why there is no single silver bullet for tackling this. This is why there is such an importance to bring all the collective brain power in this room, on your side, on our side, to actually really, how do we do this? Now, low traffic neighbourhoods are an important tool in that toolkit, as are cycle lanes, as are pedestrian crossings, as are better pavements, as are fewer cars on the roads, as are cleaner cars, as are school streets. All of these play their part. But you're right, every street, every community in London is different. You need to work with the residents, and you need to see, well, what tool works best? But I think we all know that this needs to change, and I think we're pretty confident that we've got the tools that are required, but it takes the leadership and the resources to make that difference.
Absolutely. Okay. Perfect. So, I want to say, Alan, I found the Pave the Way report for Transport very informative on the detrimental impact of LTNs on disabled Londoners. And Will, I wondered, had you read that report? And if so, what? And if you could, to be concise about it, what particular actions are you and the Mayor going to take about those responses?
So I really welcome that report. I remember talking to Transport for All beforehand. Through the thing, we provided some information. I'm really pleased that Transport for All sit on our walking forum. We have taken on board those recommendations. I think it's came across very clearly in that report just how important those goals of reducing traffic, reducing air pollution and reducing road danger are for people with disabilities. But I agree with their position that all boroughs who are implementing low traffic neighbourhoods do need to engage with all their residents, and quite often engaging with people with disabilities and maybe older people for those reasons that we're saying earlier, maybe less confident coming forward at the moment, or I think that engagement is absolutely essential. I know Alan's piece that he was talking about in the City of London. I've seen some of that work. It looks really good. I'm looking forward to trying helping champion that so that gets more coverage elsewhere. And I think what you've also seen is some of those low traffic neighbourhoods that went in a real rush, and not all of them were perfect, not all of them were delivered perfectly, but they did go on in a time of emergency. You're seeing some of the boroughs come back and look at some of this, for example, some of the blue badge exemptions that have been happening, some of the changes. But essentially what needs to happen is not change the low traffic neighbourhood and that approach, but actually improve them so that, as I said, drop curbs go in, it becomes a more conducive walking and wheeling environment for everybody, so that everybody can benefit from taking those local journeys out from from cars to walking, cycling, wheeling, etc.
Just slightly, does taken on board mean adopted?
No, that means actually, I haven't adopted every single recommendation in the report, but in terms of, I've just pulled out two key ones that we said.
Sorry, and I know this feels like a very intimate two-way conversation between me and Will, so just one quick question to bring Alan in on because it is his report. There was a lot of stats that were quite alarming in there, but one of that I found particularly alarming was that 20% of participants reported that LTNs had a negative impact on their physical health, which I think was perhaps the most alarming. So I didn't know if you wanted to say slightly more about that and how that could be combated.
So I almost feel as though I'm not needed, and between you and Will, you've covered a lot of what that report says. But certainly, what the overall message of the report is that disabled people are impacted differently by LTNs, some positively, some negatively. So the particular question you're asking about people whose activity drops as a result of LTNs, that can be because they feel the area is then less accessible to them. So it might be that the measures put in place act as physical barriers. It may be that there are some people for whom taxi or private car is going to be the only option. Cars are not just transport vehicles, a method to get from A to B, but they can act as, they can carry necessary equipment. So if you need extra things, then you need a car to carry those. So if your vehicle is prevented accessing an area, then you might get out less. So even as Will said, that 2 minutes of exercise that comes from a car journey can be cut out. So it's really important to, as has been said, consult with and really listen to and act on the views of disabled and older local residents.
Thank you. Sorry, in the interest of time, I think Caroline Russell, you've got a quick follow-up.
I'm okay.
You're okay. Okay. In that case, we will adjourn and be back at 12, just so that you've got everyone's got a comfort break. Thank you.
Are you doing okay? I kind of expected you wouldn't get glass thing, but like, wow.
A vending machine or a cafeteria, yes.
It's really fascinating what you're talking about. I didn't know how it
We have a
goes.
cafe.
So
back in session. Hopefully you had a comfortable comfort break. So I'm just going to move on to our next question. So have the Mayor's active travel schemes delivered on the aim of removing barriers to everyday physical activity for all Londoners, including for specific groups? And could this work be improved? And if so, how? So I'll start with Alison.
Thank you, Chair. I was just saying to Alan actually on the break, one of the things I haven't really spoken about today is carers, and carers of people with dementia particularly contact us frequently for assistance with travel concessions and blue badges, and the need to have a car. So their complaints are not around, being, getting on a bus or cycling. It's around the fact there isn't any parking near to the activities that they want to attend. So, I mean, that's certainly very pertinent. And we have a cycle confidence group, and we've got intergenerational cycling activities. But what I'm also finding from that is that people aren't coming back to us and saying, "I really want to buy a bike." If they do, they're worried about the cost of buying a bike, or that bike then being stolen, or where to store it. So there are massive barriers to it. And as much as we encourage our staff to use bikes in between, they practically can't because we're an outer London borough and it's very broad. So that's just some of the things that older people are experiencing in Enfield.
Thank you, Tanya.
I think I'll pick up on school streets, so an amazing initiative and great to see so many rolled out across London. I think Will picked up on more children walking in London, which is really positive, and I'm lucky enough to live on a street with a school street actually, and it's amazing to see all of the families walking down my street to school every morning and every afternoon. Like there's hundreds. But I think there is also something to do with the infrastructure change is absolutely brilliant, but then the behaviour change as well. So bringing in behaviour change initiatives, we have a WOW challenge which rewards primary school children if they travel actively to school. So something like that in conjunction with sort of school streets or the infrastructure changes could see further really positive results.
Thank you. And just as you mentioned schools, we're glad to welcome our guest from Kingsbury Green School there, which I must declare an interest because it's a school my wife went to as well. So that's it. But welcome to City Hall. And Alan, do you have anything in addition to add?
Let me just get my notes up. So there's an awful lot that has been done and could be done. We've talked about the design guidance for streets, and it's covered under the Healthy Streets approach. There's the Walking Action Plan, which does focus on that link to active travel and public transport. And there's a particular section in there on enhancing the accessibility and inclusion of London streets. So it's really important that these documents, these initiatives, do take account of disabled and older people. And I think that's something that was picked up in the Paved the Way report, and I think is not given enough focus, is that consultation with disabled people. I think one thing that we have experienced is that disabled people can be weaponised in these arguments on both sides. So their views are adapted just to suit one side of the argument, and it's clear that the reality is rather more nuanced. Looking at the cycling action plan, as Will mentioned, there's a large number of disabled people that could cycle. But one of the practical barriers is not only are the cycles themselves accessible, but how are they viewed. So a large number of disabled people use cycles as a mobility aid, but they're not recognised as a mobility aid. So when challenged, for example, only 14% of disabled people have been allowed to cycle in pedestrianised areas, using that cycle as an aid. We also see, because cycling is often seen as a two-wheeled traditional perspective, the infrastructure is often not built for disabled people that can't easily dismount. So you get barriers that prevent, that are designed to prevent motorcycles riding down alleyways, for example, prevent three-wheeled cycles, prevent wheelchairs. So there's an issue with designing accessible infrastructures. I think I'll probably stop there because we're pushed for time.
Thank you for that. Now I'm going to move on to the next set of questions from Assembly Member Boff.
Before I move on to my questions, just coming back to what Mr. Benson said, you know, the consultation, the principle of consultation with disabled people and disabled groups has to be established at the centre for others to follow. And we had the example, for example, in the introduction of the Bishopsgate Street Space Scheme, where it is absolutely demonstrated that disabled people weren't consulted when that scheme was implemented. And it took some questions on my behalf to establish that from the Deputy Mayor at the time for transport. Has the situation changed, Mr. Benson, in terms of TfL's consultation with disabled groups? Are you satisfied now that that disabled groups are being consulted adequately when it comes to innovations in transport?
I think it's fair to say that disabled groups and disabled people are being consulted. I think your question about is that adequate consultation? No, I don't believe it is. It's something that we see evolving. There is an issue, I believe, about training of staff so that they listen and that they understand the answers understand the questions to ask and the answers that they're receiving. I think often consultation takes the form of voluntary focus groups. Disabled people's time and opinion is not appreciated for its value. One of the things that we've done as an organisation increasingly across the country is run focus groups and consultations for local authorities. And I think they're getting better, but I think there's still some way to go.
Thank you very much. And let's just, well, let's not just hope. Hope is a dreadful word. Let's ensure that progress continues. Can I ask who should go for? Miss Braun. What further examples of best practice are there either in London or indeed elsewhere that you haven't already covered, because we're conscious of time, that have increased physical activity levels, including for specific groups? Because you'll get the point that some of my concerns are that when we do consult, it's amongst a very narrow band of people. What other areas of best practice could there be?
One thing that springs to mind is the super blocks in Barcelona. So creating kind of, I guess what we've kind of called here 15-minute cities, small areas that sort of have a reduced amount of cars, not a lot of cars on the road, where you can feel a lot safer and freer to kind of be, live, play. They've been very much set up with children and women in mind, particularly. There was a lot of consultation done with women about safety, personal safety, and I think, as we mentioned earlier, in the sort of barriers to physical activity and walking, a lot of those barriers come from the sort of vehicle domination that we're currently experiencing. And so in reducing that physical vehicle dominance, it's creating nicer places to be. So,
Ms. Gordon, what about what innovation, what best practice have we not talked about in this meeting that you might want to ensure goes on the record?
There's so much going on, and I mean, nationwide. I think the most important thing is that we co-produce. We literally listen to people, we talk to people, and listen to what they want, and we bring things up that way rather than us determining what people want. People need to be in the heart of the decisions that we make. There's no point in us saying let's do, a ballet session if it's the wrong part of the borough or the wrong area for people. They don't turn up. It's just a waste of everyone's time and effort. So, I mean, there's just so much. I mean, we've talked a lot about walking, we've talked lots about cycling, but any activity is positive. So if people have always had a meaningful occupation like carpentry or woodwork, the men's sheds are a really good innovation, because it gets men particularly that are more isolated and less likely to talk about health conditions and health problems together in an environment where they're physically active. They then form friendships and go off and do other things together. So there's lots of spin-offs that come from that, and they're physically moving and handling. We need to think about, I think, as Tanya or one of my other colleagues has mentioned, about breaking down activities into 10-minute blocks sometimes, so it doesn't necessarily have to be a 50-minute session, but different things that people do. So active gardening, the fire stations are talking to us about opening up their gardens so that people from the public can come in and do that.
Do you know of any do you know of any specific boroughs who are doing really well in terms of encouraging physical activity?
We are. Enfield is. We'll sing our praises here.
There we go.
So here we go. I'll blow my trumpet now a little bit here. We've been really focusing on having a proper health pathway for people who've got health inequalities. In Enfield, we've got massive health inequalities between the east and the west of the borough. So if you live in the east of the borough, your life expectancy is a lot worse than the west. And just the whole broadness of the borough, if you live in the west, you're not likely to come across the A10 to come to the east. But anyway, we've got lots of targeted sessions for health inequalities, for people who are recovering from cancer. We've got some very innovative ideas about getting people back active that probably weren't exercising before. We run 4 sessions a week for people specifically recovering from cancer. We've got the Falls Prevention Programme, which is now running 6 sessions across. We've got, in our neighbouring boroughs, we've got walking football and walking netball. We've got things like croquet. We've got everything that people say to us they want to do, we'll think about doing, whether that's going to like local boating, whether that's indoor rowing, whether that's cycling, whatever it is that people talk to us about doing, we think about ways of making that into a programme for people. And we want it to be within walking distances for people. We don't want them coming across the borough to be able to do things. We don't want people to be disadvantaged. We don't want people to be financially disadvantaged. We always sit and look at different things like that. The talking was a really good project because it was really simple and it grouped people together. They made friendships from it and they continued with that. We've also got something called the Enfield Wellbeing Network, where we've employed people as practitioners that talk to people about their outcomes, and then they match them with volunteers to actually get them to the activities. So it might be that they're there to handhold them to a few sessions so they feel confident to be able to attend, and that's really important because we talk about low motivation and loss of confidence, embarrassment, all of these factors which become barriers. But having a friendly face to actually come along with you to a session is really important as well. We've got a Fit for Life project which has 24 sessions a week, which range from the most basic exercises to the most extreme exercises. People in those sessions that can outplank any of us in the room. But you know, we try and meet the needs of older people in the borough. And when I talk about older people, we also talk about people from their 50s. And I think sometimes people have a misconception about what Age UK does. They often think we're working with the top ends of age, but we're working with women that are menopausal. We're working with people that may have employment concerns, and so we're helping to build people's confidence and well-being through lots of our activities.
Thank you. The children have gone, so I don't have to be well behaved now. So, has anybody got any examples of good practice? Yes, please, Ms. Dewhurst.
Sorry if I interrupted your question there.
No, that would do. Please.
Thank you for the opportunity to add to this conversation.
You need to put your microphone on, I think.
Thank you. I think perhaps one of the things which hasn't come out of this discussion this morning is about perhaps one of those other elements of Everybody Active Every Day. You can provide the infrastructure, you can address the environment, but actually getting people to change their behaviour and to take up some of these things has perhaps been slightly overlooked in this discussion. And I think when you look at examples such as Alison mentioned about the fantastic work that's going on in Enfield, I think most boroughs could probably talk to you about the schemes that they're doing, and there's some brilliant work on the ground. But perhaps the disconnect, and sometimes where these schemes are not as successful as they might be, is because that sort of behaviour change that needs to go on in terms of being able to enable and support people to actually want to take up and see the value in taking up these opportunities, which by and large are starting to become increasingly available within boroughs across London, is not there. And I think that's where the role of professionals such as healthcare professionals who are seeing people with the higher level of needs, and therefore perhaps the bigger barriers towards being able to be active on a daily basis, they have a real opportunity there to support the behavioural change element and actually empower people to want to and to be able to take up some of these opportunities. And so I suppose my point is really about not forgetting that part of the Everybody Active Everyday strategy. And as much as we can, making sure that these conversations are joined up. So it's not just about the infrastructure and, you know, changing the cycle highways, etc. It's also about what are we doing to actually make people want to therefore get on a bike and enable them to do so. And so my example of good practice would be all the work that's been done with Moving Healthcare Professionals, which is a suite of options around training, around education, to really empower healthcare professionals to recognise their role in having those conversations with patients and doing just that simple intervention in terms of regular conversations to really up the ante and make people understand that actually in terms of managing their health and achieving their life goals, physical activity has a really important part to play.
Thank you. Mr. Norman. Dr. Norman, sorry.
I was going to say, I'm not going to talk about any of the stuff that we're doing, but I think what is so important in this, there are so many solutions that brilliant people are coming up with in communities across all of London. And there's a mechanism of how to embrace that. I met a guy last week who had started a walk. Someone mentioned Men in Sheds, which is a brilliant programme in terms of getting men to talk about some of their mental health issues. To set up, just because of his own personal experience, set up what he's called the Proper Blokes Club, and it's a walking group. It started off with him just putting something out on social media saying, anyone fancy a walk and a talk, and one person came up. Yeah, he's now got groups across 4 or 5 different boroughs, regularly meeting, having those conversations of walking peace. Now, it's those sort of ideas that are, not everything is top down in terms of what comes up. There's brilliant ideas happening at that level, and I think there's something of all of us need to listen to that and think they can't all be scaled up, but how do they get replicated? How do we sort of see, how do other people see what's going on that works? And so I think there is a really important part of that innovation, that it's not just sort of top-down innovation, it's bottom-up innovation, because they're brilliant solutions out there within the community, and I love those things. Yeah.
That sounds like an innovation that I'd quite like to take part in, as long as there was a beer involved at the end.
I believe there is.
I understand that that's the case. It may completely negate the health benefits, but what further action could public bodies such as central government and local government take to reduce those? let's not talk about the GLA. That's going to be my last question. But what action could be taken by boroughs to reduce those barriers to everyday activity, Ms. Hobart?
Can I just reflect one piece of work in London which has a lot of interest in, which is around the NHS's approach to sustainability. They've had green travel plans for a while. I'm looking to Katie at the moment, but there is a big push on that around the NHS's net zero commitments and looking at the impact that the NHS has. If you think of the number of journeys that are related to staff, patients, carers, support agencies, wider procurement chains. So there's certainly a lot of interest in that. Actually, Katie's been quite active with that group in ensuring that active travel is picked up as a key part of, in London and with London colleagues, around that kind of sustainability plan, which I think is encouraging. If you think of the challenges we've talked about today, about reach across the whole of London, as well as into different communities, certainly the health and care system does have a different ways to reach London as both as staff, patients, carers, etc. So I think that's potentially quite exciting.
Thank you very much. And now the final question is about what the Mayor can now do to reduce the barriers to everyday physical activity for Londoners. And we've already established during this meeting that he could do a lot more to be consulting a broader group of people. But who would want to come in on that? What more can the Mayor do? I don't want to hear from Dr. Norman on this, because, but from perhaps Ms. Gordon.
Thank you. Possibly funding. I think lots of things come down to funding. I mean, I think Will mentions about lots of innovation, which is from the ground up, which is really important. It really is. I mean, and that's what I was talking about with co-production. But we always need funding. We can't do these things without any money. So it's like, more pots of money to be able to support us, to lead on innovation. Always the problem with funding is like it'll support you for a project for a year, and then after that they expect you to have another bright idea. But some projects need to be sustained. They're fantastic and they need to be continued. So I think that's probably one of them. Making sure older people's voices are always heard and consulted and are in part of all conversations. And carers, carers again are often very neglected. People don't ask carers their opinions on things. So I think making sure that there's an opportunity for people to talk about what's important to them. And travel concessions, again, the old famous travel concessions issue about, I came in this morning, I said I saw one older person, that's it. They're just not coming out until a bit later on in the day.
And what engagement has Age UK had with any deputy mayors over these issues?
I actually am not sure about that. I'm going to look at Abigail, who's behind me, who's from Age UK as well. I can feed back on that one if that's okay.
Yes, thank you very much. And perhaps Tanya, what engagement have you had with deputy mayors with regard to increasing physical activity?
Well, we've had quite a lot of engagement with Dr. Norman and with TfL. We have a quite vocal London Living Streets group, which is essentially a volunteer group. They're a group of campaigners, and within that sort of large group there are a number of smaller groups. So they're very local, very knowledgeable about street infrastructure, what good community should look like, and so they have been continually consulted as to new initiatives, ideas, and they actually supported TfL to look at crossing waiting times, because that can be a bit of a barrier in terms of walking, and they were reduced with TfL a couple of years ago, which was a really amazing piece of work that happened with our volunteer group.
So I'm not going to give anybody a chance. Is there anything more the Mayor could be doing that he currently perhaps is not? Ms. Dewhurst.
I would like to take this opportunity just to thank Dr. Hunter for her encouragement of our clinical champion training, especially with regards to the active travel section, but to ask perhaps going forward that the Mayor's office think about the platform that they might have to be able to be able to share information about the training. We have 12 clinical champions across London who are available to educate healthcare professionals, including social prescribers, which we touched on earlier, in terms of a key part of the workforce in terms of supporting those most in need to become more physically active. We have people who are readily available to offer this training to healthcare professionals across London. Currently, our levels, since 2019, we've only been able to reach just over 2,000 London-based healthcare professionals, which is not incomparable with other regions, and notwithstanding the challenges of COVID in terms of being able to deliver training, but also in healthcare professionals being able to be released to attend training. But I think there's an awful lot more we could do, and I'd be grateful for any support the Mayor's Office are able to offer us in terms of being able to champion that training and to get the message out.
Thank you. Dr. Norman.
So I think there is clearly, and I think we've heard today, there's a huge amount more we need to do. And I think we just need to emphasize there is a global physical inactivity crisis. We've got the most inactive generation of kids in history. Physical activity has been designed out of our lives. The chronic disease burden that this is resulting in has the potential to bankrupt health systems across the world, not just here in London, but in every society across the world. And so we all need to play a role in this. And it's really good seeing all the partners across the voluntary sector. Clearly, the Mayor, the GLA, the leadership within local government and central government have a really important part to play. And I really welcome, actually, this investigation into physical activity is the first one that I've experienced in my time in this role. And it's such a critical piece. So really welcome the GLA's investigation to this. I think there is a piece of the puzzle that we haven't talked about, and not in this session, but it might be worth considering as part of your ongoing investigation, is actually the role of the private sector through employers. Employees, what role does the private sector play? Because this has to be a cross-sectoral, cross-government partnership, and everybody has a role to play in tackling this crisis because it is so serious, and it doesn't always get the spotlight which I think it deserves given the consequences it has on individuals' lives, but also just for our economy and our health system that is under immense pressure. So thank you for the investigation, but it will take all of us to turn this around.
Thank you very much, and I do hope that the Health Committee's recommendations are listened to by the Mayor. I hope you do more than just take them on board, that you do actually execute.
Alan, you wanted to come in?
Anyway.
Sorry,
Alan. Mr. Benson.
Just briefly, if I can. We've talked a lot about physical barriers today, and as I mentioned earlier, nearly 70% of disabled and older people want to do more activity. So we're pushing at an open door. I think one of the things that is worth emphasising that we've touched on is that co-production of solutions to make sure that they are suitable. And I think one of the things that we've not mentioned is an ongoing issue with bus stop bypasses. We're many years into bus stop bypasses and they're still not suitable for purpose. But talking specifically about something that the Mayor can do, only 2% of images in documents show adapted cycles. Attitudinal issues, internalised attitudinal issues are a big problem. People don't believe that activity is for them, whether that's exercise, whether that's walking, whether that's cycling. If we can get more images showing more older people, more disabled people, then we can communicate to people that it is possible, there are solutions, there are options. So it's really key that we change those publications.
Yeah. Actually, that really comes home, because I remember going to see some of those. I think it was the one in Herne Hill actually, where they were adapting South London anyway.
Herne Hill Velodrome.
Yeah, and they were adapting bikes, for example, for disabled people. And what struck me is that I'd never seen one before. And I was really surprised that and actually, we should be showing people that these are cycles and that they are a method of getting around London. So thank you for that.
If people don't know what's possible, then they won't do it. They won't know what's available.
Absolutely. Thank you very much. Thank you, Chair.
No, thank you, and really brings it home. I visited my constituency where we have a disabled people's group that allowed us to try the adapted cycles on a track, which was enjoyable, but it just shows what is possible out there, and the point that you made on images, I think, is very important. So I'd like to close the discussion and thank all of our guests for your contributions today. Some business for the committee. Can we note the report and today's discussion?
Noted.
Can we also delegate authority to me as chair in consultation with group lead members to agree outputs from the discussions?
Agreed.
And can we note our work programme?
Noted.
And the date of our next meeting of the committee is scheduled for the 24th of November at 10 a.m. here in this chamber. I have no urgent business and I therefore declare this meeting be closed.